The purpose of this presentation is to show the ability of the Eidos intelligent system to identify human diseases. The decision on the practical application of the methods in question in medical institutions is made by the attending physicians. After reading a lecture on the relevant topic, training databases are supplied free of charge upon request. The author of the developed method for diagnosing human diseases disclaims any responsibility for your choice or non-selection of training databases, therefore claims of any kind are not accepted. Use them if you like them, and if you don't like them, don't use them. Decide for yourself and bear responsibility for your decision and the consequences of your use of the Eidos system. For the Eidos system to produce reasonable results, there must be patterns in the training set. If they are not there, then the Eidos system cannot detect them. It is similarly impossible to make good cutlets from dirt. Even if there are patterns, but the noise level is many times higher than the useful signal, and the training sample is so small that it does not allow suppressing the noise, the results will also be disappointing. Most databases hosted in the UCI and Kaggle repositories are not suitable for use by intelligent systems without additional processing. Any training sample always contains not only true information about the modeled subject area, but also misinformation or just noise. It is clear that noise and misinformation in the input data lead to a decrease in the reliability of the models created from such input data. Researchers at the medical faculties of many universities perform many years of research, conduct examinations, screenings, collect the results of analyses and tests of several hundred patients. Large data sets are very long and carefully processed. But such studies require several years of work, and the results are not always available to other medical professionals. However, based on the developer's existing knowledge, it is possible to compile empirical databases, and then select the tools for their processing in the form of an intelligent system. It is important that such a system be able to distinguish between valid and invalid instances of the training samples so that the researcher can eliminate invalid data or refine them. For machine learning of the Eidos intelligent system to recognize diseases, it is necessary to develop a training sample. The more copies in the sample, the more accurate the results of the study. The optimal size of the training sample is 300 copies. A database for diagnosing early-stage chronic kidney disease has been compiled by P. Soundarapandian, Senior Consultant Nephrologist, Apollo Hospital, Managiri, India. Missing attribute values, indicated by in the database, were supplemented by empirical data and were also taken from the examination of a 50-year-old woman admitted to the Maisonneuve-Rosemont Hospital with complaints of uncontrolled blood pressure and sudden pain in the left side of the body lasting 24 hours, occurring over 6 weeks before hospitalization. After eliminating a study was carried out in the database using the Eidos system. The lectures, a list of which is given on the website https://www.youtube.com/watch, v=uhakvkepsi8, are intended not only for medical personnel. School children, students and older people can listen to them to gain knowledge about the benefits of a healthy lifestyle. Listeners can give up bad habits to reduce their risk of stroke, lung cancer, diabetes, or other diseases. Lectures can be listened to by vacationers in dispensaries and sanatoriums as an educational event. Based on the lecture material, you can conduct practical classes with students, prepare master's and doctoral dissertations on the use of the Eidos intelligent system in a number of different subject areas: regional, sectoral, and enterprise economics, technical sciences, intelligent control systems and renewable energy, technical sciences, reclamation and management of reclamation systems, psychology of personality, professional and educational achievements and analysis of extreme situations, scientometrics, medical diagnostics, decision-making on the choice of rational agricultural technologies, Geophysics, forecasting earthquakes, parameters of the Earth's magnetic field and the movement of the Earth's poles. The liver disease diagnostic dataset was collected from northeast Andhra Pradesh, India. The Eidos intelligent system helps people to know the prognosis of the risk of developing liver disease at a low cost, and also helps people make appropriate decisions based on the certain risk of developing the disease. The proposed methodology for diagnosing liver disease can be used by hospital staff, since the Eidos system has free access to the Internet and you can change the user interface language to an accessible language of communication. The application of the new research methodology in practice will reduce the time required and improve the reliability of the results of diagnosing people's health. The database for classifying the degree of angina heart damage contains the following features: age, gender of the patient, type of chest pain, resting blood pressure, blood cholesterol and mg/dl, excess of fasting blood sugar values of 120 mg/dl, yes, no, resting ECG results, peak heart rate achieved, exercise-induced angina, yes, no, ST segment depression, 0 to 4. 6. ST segment tilt at peak exercise, number of large vessels stained at fluoroscopy, type of defect, normal, fixed, reversible. Computer scientists and doctors can initiate an annual electronic survey of the adult population of cities using the Eidos intellectual system. The presence of asymptomatic angina significantly worsens the prognosis of the disease, especially in the absence of adequate therapy in these cases. The sooner a correct diagnosis is made, the sooner the patient is hospitalized and receives adequate treatment. Machine learning technology is well suited for developing diagnostic and prognostic rules. Data on correct diagnoses and prognosis can often be obtained from the archives of specialized hospitals and clinics, where the number of cases stored is growing every day. The database for the classification of initial tumors was developed by the University Medical Center of the Institute of Oncology in Ljubljana. The class diseased organs contains the following names of diseased human organs: lung, head and neck, esophagus, thyroid gland, stomach, duodenum and small intestine, colon, rectum, anus, salivary glands, pancreas, gallbladder, liver, kidney, bladder, testicle, prostate, ovary, uterine body, cervix, vagina, breast. It is proposed to diagnose the initial stage of tumors using the Eidos artificial intelligence system based on symptoms stored in the UCI repository. Timely diagnosis and localization of tumors allow early use of radiation, chemical and hormonal therapy, which contributes to the recovery of patients. The data set for the diagnosis of breast cancer was obtained after performing a fine needle aspiration puncture biopsy of the breast. This is a diagnostic procedure, the essence of which is to obtain samples of neoplasm cells contained in the mammary gland for histological examination using a thin needle. This dataset, created by renowned general surgery and computer science researchers at the University of Wisconsin-Madison under the direction of Dr. William H. Wahlberg with contributions from Professor W. Nick Street and Olvi L. Mangasarian, has been used in some pioneering studies to predict breast cancer. Scientists at the University of Wisconsin-Madison conducted painstaking and complex histological studies and identified 30 features of breast cell samples obtained by fine needle aspiration biopsies from patients with benign and malignant tumors. This Wisconsin breast cancer dataset provides an invaluable resource to scientists working to prevent or treat this devastating disease. The reliability of the diagnoses established by doctors and specialists was confirmed using automated systemic cognitive analysis performed using the Eidos intelligent system. The database for determining stroke risk is taken from the Kaggle repository, but it has been significantly improved. Records reflecting factors for the presence of the disease in persons under 18 years of age were excluded. Records that did not contain information on smoking status were also excluded, and information on body mass index was added because anyone can calculate this indicator. For those who want to determine the risk of stroke, almost all factors are known except blood glucose levels. Although this indicator is not difficult to determine, since there are even portable devices for obtaining glucose test results. Thus, the number of patients in the study was reduced to 1,000. Early prediction of diabetes plays a vital role in selecting appropriate treatments for the patient to avoid severe consequences. Thus, having established an improvement in the patient's condition, it is possible to treat him at minimal cost. If practical changes are carried out without mathematical research, then large expenditures of money and other resources will be required. In addition, the duration of the experiments will be long, and the results will become unpredictable. With computer modeling, there will be only minor costs for the researcher's salary and electricity. The positive effect of using automated systemic cognitive analysis to predict the condition of patients is obvious. If the training sample includes all objects of the general population, that is, they coincide, then the reliability of the conclusions will be the highest. If the training sample is very small, then it is unlikely that reliable conclusions about the general population can be made on its basis, since in this case the training sample may not even include examples of objects from all or the vast majority of classes. By representativeness of the training sample we mean its ability to adequately represent the general population, so that the study of the general population itself can be correctly replaced by the study of the training sample. But representativeness depends not only on the volume, but also on the structure of the training sample, that is, on how fully all categories of objects in the general population, classes, are represented and on how fully they are described by features. The Orinda longitudinal myopia study was conducted to collect risk factors for myopia in children. Data collection from predominantly Caucasian children aged 6 to 14 years began in the 1989 to 1990 school year and continued annually through the 2000 to 2001 school year. The data stored in the Kaggle repository was finalized by an experienced ophthalmologist. The dataset extracted from magnetic resonance imaging images contains 1,500 variables for various features. 4 types of cancer are diagnosed. Cancer type 1 is pituitary adenoma, which has 122 observations. Type 2 is germinoma, with 247 samples. Type 3 is meningioma, which has 155 samples, and type 4 is glioma, with 176 observations. Each measurement is a sign of brain cancer, and their processing using the Eidos intelligent system helps in diagnosis. The intelligent system Eidos is posted on the Internet for free use, and the proposed method of dividing the Kaggle repository database into 4 parts makes it possible to recognize brain tumors with high reliability. A detailed description of the research methodology is given in the lecture, a list of which is given on the website www.youtube.com/watch?v=OQVKPCI8. Lectures are presented in the form of presentations with audio recordings in English. A dataset for automatic glaucoma assessment using fundus images was published on March 15, 2019. Authors: Andres Diaz-Pinto, Sandra Morales, Valerie Naranjo, Thomas K. Hler, Jos Masi, Amparo Navia. The Acroma database consists of 705 fundus images, 396 glaucoma 2 and 309 normal images. They were collected at the Fizabio Oftalmolog, A.M. Dica in Valencia, Spain, from healthy and glaucoma patients with their prior consent and in accordance with the ethical standards laid down in the 1964 Declaration of Helsinki. All images from the Acroma database were annotated by glaucoma experts with many years of experience. They were trimmed around the optic disc and renamed. The spring 2011 version of the Eidos system provided for a training sample size of no more than 100,000 objects. In the current version this limitation has been removed, and now the system can work with millions of objects. However, there is still a limitation on the size of knowledge bases, no more than 4,000 classes and 4,000 gradations of factors. The Universal Intelligent System Eidos has a very complex user interface and 55 operating modes, not counting the exit mode. It is almost impossible to learn how to work in the Eidos system on your own. Any error will cause the system to stop or produce incorrect results. To reduce training time, it is recommended to familiarize yourself with the lectures, a list of which is given on the website. www.youtube.com/watch?v=OQVKPCI8